doing today?
Doing good.
Good. My name is Scarleth, and I'm going to be your student nurse today. I'm just
Okay.
here to do a quick head-to-toe assessment.
Okay.
Let me just wash my hands, close the curtain for some privacy. I'm just going to put on my gloves. Do you have any allergies?
No.
No? Okay, perfect. Can you please confirm your first and last name for me?
Chloe Chen,
Okay, and what's your date of birth?
June 10, 2004.
All right, perfect. What hospital are we in today?
We're at HCC Hospital.
Okay, perfect. Patient is AO times 4. And then I'm just gonna start with some quick vital signs, okay? All right, vital signs are within normal range. I'm gonna check for any equipment, oxygen lines, IV lines for your own safety, and there's nothing within sight. Now, what brings you in today?
For my pain.
Your pain? Okay. Where is your pain?
In my abdomen.
Your abdomen? Okay. When did the pain start?
It started recently.
Recently? Okay. And could you describe the pain for me?
It's just like sharp out of nowhere.
Just sharp out of nowhere? Okay. And how often does this pain happen?
Like a few times a day.
A few times a day? Oh, wow. Okay. What makes your pain better?
I guess moving around.
Okay.
helps it.
And is there anything that makes your pain worse?
Like sitting down for a long time.
Oh, okay.
Mhm.
Have you had any treatment for your pain?
No.
No? Okay, so if you could rate your pain for me from 0 being no pain at all and 10 being the most pain you've ever felt.
I would say it's a 4 right now.
A 4 right now? Okay, would you like any pain medication for that?
I'm fine at the moment.
Okay, so you say it's manageable?
Yeah.
All right, so I'm just gonna raise your bed real quick, if that's okay with you.
Yep.
Okay, I'm just gonna do some quick vital signs. Okay, vital signs are within normal range. And so I'm just gonna start with your head, okay? Is it okay if I touch your head?
Yeah, that's fine.
Okay. All right, head is clear of bumps and lesions, so that looks normal. And then I'm just gonna check your ears. Pull up and back, other side. All right, ears are free of discharge and there's no redness or swelling. I'm gonna check your mucous membranes, okay? Mucous membranes are clear. Could you open your mouth for me? Perfect. Mouth is free of lesions, moist and glistening. Could you also smile with your teeth? All right, no missing teeth, and face is symmetrical on both sides and even. Now I'm just gonna check your pupils and your eyes, okay? If you could just stare straight ahead for me, and I'm gonna try not to blind you. Good. Okay, pupils are round, even, and reactive to light. Now I'm just gonna have you look at the tip of my pen and follow it with your eyes. Good. One more time. All right, eyes are also accommodating. Now I'm just gonna check your lymph nodes, okay? All right, there's no swelling or tenderness in the lymph nodes. I'm gonna feel your carotid pulse. All right, pulse is normal, 2+. Okay, now I'm just gonna go ahead and just check your skin real quick. All right, skin is normal. There's no open wounds or any redness or bruising or discoloration. Now I'm gonna check your skin turgor. All right, tenting is normal. That seems good. I'm gonna check your capillary refills. All right, and the other side. All right, good. Capillary refills is less than 3 seconds. Now I'm gonna check your radial pulse. Good. Good. Okay, pulse is 2+. Now I'm just gonna do your respiratory. Have you had any chest pain lately?
No.
No chest pain? Okay. Could you take 2 deep breaths for me and cough?
Do you want me to sit up? Oh, sorry.
All right, perfect. Now, are you able to sit up for me? All right, perfect. Thank you. Now, I'm just going to auscultate the lungs. If you could just take a deep breath for me.
Too small, they don't have a
Good.
pediatric one.
Good. Good.
How did they do it?
And two more.
No?
Last one. All right, thank you so much. You can sit back down. Lungs are clear, free of crackles, wheezes, and all within normal range. Now, while I'm here, I'm also gonna check your heart sounds, okay? And you said no chest pain, right?
Is you're in behavioral right now or something?
So I'm gonna check the aortic, pulmonic,
Things like that, right?
Erb's point, tricuspid, and your mitral.
Not even to do the
All right, heart rate and rhythm are all within normal range. I'm gonna move on to your abdomen. Have you had any nausea or vomiting lately or today? No? Okay. How about your bowel movements? Are they normal?
Yep.
Yeah, and then any painful bowel movements?
No.
No. When was your last bowel movement?
Recently, like an hour ago.
Like an hour ago? Okay, perfect. And then what about your urine? Do you have any pain when urinating?
No.
No? Okay. And when was the last time you urinated?
Like an hour ago.
An hour ago as well? Okay, and then everything's normal, the color and everything? Okay, cool. All right, so I'm gonna check your abdomen. So abdomen is flat. There are no bumps present. The skin is free of discoloration. There's no bruises, so that looks normal. Now, after inspecting it, I'm just gonna take a quick listen to your stomach, okay? All right, thank you so much. So stomach is normal. There are present bowel sounds in all 4 quadrants. Now I'm just gonna palpate and feel around your stomach, and you let me know if you feel any pain, okay? All right, palpation is also normal. There are no masses or any lumps on the stomach, so that's all good. Now I'm just gonna move to your extremities. Have you felt any numbness or tingliness on your feet?
No.
No? Okay. So I'm gonna check your calves for edema. All right, there's no swelling. Both calves are symmetric to one another. There's no redness or any open lesions or discoloration, so that's normal there. Now I'm gonna just have you push your feet against my hands. Perfect. And then push towards my hands. Perfect. Both feet are equal in strength. And then I'm also gonna have you hold my hands as well and squeeze. All right, perfect. Both hands are also equal in strength. Now I'm gonna feel the capillary refills on your toes, okay? All right, capillary refill is less than 3 seconds on both feet. I'm gonna check your pedal pulse. All right, pulse is within normal range and 2+. All right, so I think that's about it. Everything is within normal range. Do you have any questions for me?
No.
Do you need anything right now? Are you comfortable?
Yeah.
Okay, good. Well, thank you so much for letting me do that. I'm gonna put the call light here within reach so you can call me if you need anything, okay? I'm gonna throw these, perform some hand hygiene and wash my hands, and open up the curtain, okay? Well, you have a great day, Miss Trin. All right. Did I miss anything?